Welcome again to our next installment on our series of common foot disorders, and we're going to be talking today about foot deformities. As podiatrists, we see an awful lot of foot deformities. It's really common for toes especially to develop deformity over time, partly due to the fact they're taking all our body weight on them into our feet, and also because of the environment we put our toes into, which is generally those closed-in shoes, and those shoes aren't necessarily foot shaped. So the sort of foot deformities that we can see, in particular in the forefoot, would be bunions, which is where the big toe goes over, and that's a broad name term for a condition that we know more specifically as hallux abductor valgus. Would be the typical bunion, but there's other things that can go around with the big toe joint that can give the appearance of a bunion, but might actually not be. It could be an arthritic lump in the case of hallux rigidus, for instance. The hallux is the big toe. You can get hammer toes, which commonly affect the second toe, where it buckles up, or it can actually be overriding, particularly in the case where there's a bunion in the adjacent toe. Clawed toes and curled toes are all common things, with subluxation or dislocation of the joints in the forefoot. You can also get fractures that can lead to foot deformities, particularly fractures of toes. They're quite easy to break, the toes are. But if we go further into the foot, then you can have bone coalitions that can lead to deformities. In certain medical conditions, then we can get things like Charcot foot in patients that have got a foot with no sensory feedbacks, for instance in diabetic feet, where they've lost sensation. They get neuropathy, and that can lead to something called a Charcot foot, which, if left untreated, goes on to form a true rocker bottom foot, where there is no arch in place in the foot because of the complete collapse of the foot in the midfoot area. But there's other foot deformities that can occur not in the bone, but in the positional sense, as a result of things going wrong with the musculature, for instance. So if you've got spasticity in the muscles, your foot can go into a position that wouldn't be easy to walk on. And the same with if you've got flaccidity in the muscles, so you're not getting support from the muscles, and that can happen in patients who are also hypermobile. And with there being 33 joints in the feet, with our whole body weight going on them, if you're hypermobile, then the structure of the foot might struggle to support that body weight, and you can develop issues as a result of that. There's also that misnomer of pronation and excessive pronation, and the opposite being supination, where pronation technically is flat feet, and supination would be high arch feet. But what's strange about it is these aren't actually diagnoses of problems. They don't predict problems necessarily. They're just a positional description, a bit like whether you've got brown eyes or blue eyes. It's a description of your eye colour. So we look at a foot function a lot more in depth than just saying if somebody's pronating or supinating, because actually those are normal function movements for the foot during the walking cycle or running cycle, or whatever activities you're planning to do on your feet. But other deformities that can develop when you have got some high foot posture index, for instance, where it's a very flat foot, something called Pes Plano Valgus, colloquially known as Pes pancakes, because they can look as flat as a pancake, but they may be correctable, and correctable as in it could be flexible, in which case that would lead to a different treatment plan than if it was something that was a more of a rigid fixation. So all of these foot deformities exist, and we can assess them and give best advice on how to manage them. But very commonly with these deformities, you can end up with a degree of osteoarthritic change, so arthritis in the joints over a period of time, and that can become painful. Whilst there is no magic cure for arthritis, particularly in the foot, you don't easily get joint replacements that work well, like with hips and knees. They have tried them in ankles and big toe joints, and sometimes they can work, but it's not as successful as in the larger joints in the body. So you can be left with long-term pain with bony deformities or even muscular issues going on. And we're fortunate enough at our clinic to have something called high-intensity laser therapy, which is an absolute game changer when it comes to arthritic pain in the feet. I've seen such a tremendous improvement in symptoms with patients as a result of using laser therapy on their arthritic joints. So if you're having any problems with foot deformities, give us a call on 01926 811 272, or look at our website, healthfirstsouthern.co.uk. You'll find a virtual podiatrist page on there, so you can actually look up your foot pain and see some more information about it before getting in touch, or come in for an assessment and all the advice that we can share with you for the management of your condition. Also check out our YouTube channel, Health First Foot and Gait Clinic, and you'll find lots of useful information on there as well. Thank you. See you again. Bye for now.